One, I really want to appreciate the panelists, and I'm going to introduce them at some point, and also indeed everyone who's made time to be in this conversation. It has to be more than a conversation. I hope it will get some of us interested in pursuing some joint collaborative work to try and address this. And as I'm going to share, yes, it is a crisis in the scenario of the USA stop work order, but is that really new? And I think that will be part of the questions that we'll be trying to answer. And for me, I ask myself, why is this important? I believe it's important because aid and supporting people in need is something that makes us human. So it is so integral in our part that we can't ignore it, and that is really the philosophy of Ubuntu. I also think it is very important because when you look at what the world requires in terms of the humanitarian support, whenever there are crises which are increasing due to climate change issues, we've rarely gotten to half of what is required. So when you look at the UN report, the UN OCHA especially, we have about 50 billion required to respond to humanitarian crisis. And we just got about 43% last year. And in Eastern Africa, just about 44% of that is what we've gotten. But also something that I hope can be a follow-up conversation beyond today is what are we spending aid on, especially in the context of Africa? So the climate change issues, and this is from the Overseas Development Assistance official reports. A lot of what we are having is being spent in responding to climate-related challenges, food system issues. The oil crisis we still have. DRC is currently in big trouble. We have Sudan. We are having heat waves now. Schools are being closed in South Sudan. And these are things that could have been, predicted and managed in advance. And for me, also very bothering is when you look at even where the bulk of the USAID funding has gone to is on health, education, agriculture, food security, which are really intimate issues for every country. You expect that the government will handle that. And overall, very interesting statistics is that in 2023, we had one of the highest overseas development assistance, commitment being delivered by countries. This is about 223 billion, which was higher than 2022. But in that, of course, you see that most of the countries are not meeting their pledge of at least 0.7% of their gross national income. But even worrying in that list, rarely do you see other countries, that are in the developing countries band group. But so there is this call, therefore, that indeed, as we think about aid, we really need to ask ourselves, are we getting more people, more countries being involved? Are we having an element of power sharing and influencing coming into this so that we have a more sustainable funding, especially in the context of SDGs? And with this, I'm also reminded of a prophecy, I want to call it that Dambisa Moyo made some, that's over 10 years back, 2009, in a book, Dead Aid. And, in the forward, there is a summary that is put there that, she asked, what if one by one African countries received a call telling them that in exactly 5 years, the aid taps will shut off permanently? This was in 2009. So with the case of the Trump administration and, what we're seeing, the change that is happening, this seems to have happened in a much shorter period. And therefore, I think this really sets a reason to ask ourselves, were we not prepared for this? Especially countries in Africa who've been the bulk receivers of what is being committed by the overseas development assistance. Now, we've done a survey in the last 2 weeks, not only in preparation for this, but to really inform us to what extent are people being affected, organizations being affected. It's already quite a heavy report, but just want to give you a glimpse. So far we've had 57 respondents. These are organizations from across Africa. As you can see, the countries so far represented: Kenya, Burundi, Botswana, Ethiopia, all the way to West Africa, Liberia, Nigeria, Cameroon, Central African Republic. Really, we appreciate this. And we are seeing the bulk of the organizations who have responded are those who are 10 years and younger. So since it's not a complete random sampling, we wouldn't say that that is the representation, but it could be a telltale thing that you're having a lot of these organizations at 10 years or so. There are those who are as old as 67 years old. Majority of those who responded are national organizations. Again, it's an access to resource issue, the ability to connect to information, and that will also affect the ability to resource mobilize. The bulk of these organizations have less than 20 employees. The distribution in terms of the thematic areas they are addressing, the majority are in child protection. There is the health and WASH. There are those who are also in gender equity, governance issues, and human rights. So again, it tells you what will be the impact of change in the way the global aid framework is being done. What is the impact? The greatest, most reported impact in this stop work order is in relation to halting projects. So projects have been stopped. There are layoffs happening, and even legal suits. There are legal risks that these organizations are being exposed to. Perhaps that's not too much of news for you. And what also interested me is where is the bulk of the funding, the primary source of funding for most of these organizations. And you can see here, I don't know whether this is a glimpse of hope, that about 36% are saying US government, and another 36% reporting local funding from either private sector mostly, and a little bit from local governments. So perhaps there is an opportunity. But just some footnotes there, which I think are also very interesting, that the more younger organizations were largely reliant on US government funding. So I think that's a risk. And also that the ones that are, the national organization seem to be having a mixed portfolio, EU, US government, but the community level organizations had the bulk of their funding coming from the US government. So you can begin seeing the impact that is going to be there. Now, I'm not the expert today. I am not speaking. I want these great people to really share their insights as it relates to this data that we are having, and much more that will be building from their own experience and their own research. The first of all, in our speaker team, speaker list is Yvette Raphael. Yvette comes in with quite some experience working, especially in the HIV advocacy. She is the Executive Director of Advocates for Prevention of HIV in Africa, and a member of the Board of Trustees for MTV-based Stay Alive. And having lived with HIV herself and done a lot of campaigns and work on fighting stigma, promoting education, I think she comes in to tell us really where is the shoe pinching the most. So I really look forward to listening to Yvette. At some point, she will be able to speak. We also privileged to have, and by the way, I need to say Yvette works from South Africa, and that gives us a good South African perspective also. Our speaker number 2 is Angelo Katumba. Angelo has over 20 years of experience in working in scientific research. He's done quite some role in capacity building, and looking at facilitating the rollout of prevention treatment interventions on HIV. And, also having worked as a journalist first, from Uganda, I think it brings in good perspective in being able to really look at the big picture. Where is this going? And he has great interest in decolonization. And so I want to hear his perspectives around that. Our third and last speaker here is Dr. Michael Kiragu. He has great interest in grants and fundraising, and he runs a firm called the Bell Consultants. And he supported a number of grant and fundraising, quite a range of organizations from the UN to, the philanthropists like Bill and Melinda Gates, and has also worked in building capacity of nonprofits in fundraising, and it's really great to have these 3 gentlemen here. I'm 2 gentlemen and a lady. I'm grateful to be doing this as a moderator. So after this, I'll say very little. I come in with interest in leadership and governance. I'm a doctoral student on this, and also a founder of the African Institute for Children's Studies. And we are really living out our purpose, having African voices where it is required. So, ladies and gentlemen, let's welcome these team members. And I just want to go straight into the questions. And I want to begin with Yvette. Yvette, thank you very much. I hope we'll be able, your camera is on and we'll be able to, to see you as you come into this. I want to ask you first, you've been on the space of working with nonprofits. And I'm wondering, with the scenario that we are having, almost, I have a question. Do we really need nonprofits in Africa? What role do they play, and how important is this to the continent? Over to you.
Thank you so much. Good afternoon, everyone, and thanks for the invitation. Can you see my camera? Can you see me clearly? All right, because I'm always camera ready. So thank you for that question. And I will give a little bit of background, and it may be very controversial, but I think this conversation is really much needed, and we are at a point where we have to reflect. Every crisis has an opportunity, and for us to take stock, for us to reflect and to create opportunities. So just a bit of background. NPOs are meant to fill a gap where our governments are not able to provide. We are not supposed to do the work of our governments. We are supposed to be there when our governments are not able to supply services or even provide for their communities. Then we have civil society. Civil society, in most cases, are meant to hold governments accountable, not fill the gap, hold governments accountable. And that's why we see a lot of protests. We see a lot of, protest movements, et cetera, et cetera. And then there's issues around advocacy where we advocate for things to become available for some where our governments don't see, where policymakers don't see. We advocate for those things that are a gap. But then activism is also part of all of this. But I think over the years, have we mixed up these things, right? We have become comfortable. We have mixed up what the NPOs are meant to be, what civil society is supposed to be, advocacy and activism. So everyone is an activist. You know, when you go into some of our spaces, Angelo knows this. I usually would say, now, if everyone is an activist, then there's going to be a problem. And I think one of the things is that we did not see we knew it's going to come one day, but we did not see it coming in this way where it would affect livelihoods. Apart from the poorest of the poor, the neediest of the needy in Africa, not having medication, not having food, not having all kinds. And it's just not the AIDS field. It's not just the HIV field that is impacted, but really aid across the globe. So we knew it was coming. What we did not know it's going to be in this at this magnitude, this fast, and also taking almost like pulling the rug under us. So we were given a wake-up call. Aid is not really aid. Aid comes with conditions. Most of our countries have signed up to this aid with conditions that certain things will happen. There would be relations, there would be, some kind of working together with the governments that are able to fund some of the work that we do and we supposedly say we are doing. Like I said, there are conditions, and it's really crazy that today, my generation, we have to believe that the richest continent needs aid. And it means that our minds are not decolonized. We cannot need aid when more than half of the minerals of the gold globally comes from a few kilometers from me. How do we need aid if that is we are the richest continent? So our work is mainly around advocacy and HIV prevention, right? And information and you know, mobilizing communities. But
now, Yvette, I like the point you're bringing, and maybe if you just give us your, your take home on that. Are you agreeing that with all the differentiated roles of NGOs, civil society, do we need them in the continent? And if we need them, who should pay for them?
I actually thought I would answer you by my introduction. Advocacy should not be funded because I was getting there. We are an advocacy organization, right? So our advocacy is where governments, where policymakers, where pharmaceutical companies are not doing the right thing. So our funding should then be different. We should not be in a space where we are sitting in a situation and we are unable to work as advocates because of the funding. And that is why my organization, our organization, when the money stopped, one of our principles was that our organization will not stop working because we've worked without this. We need advocacy, we need activism, we need non-profitable organizations to fill the gap. But I think now is the time for us to think around where each one fits. And I said that in the beginning because now everything is muddled. We are not getting to a point where we know which is which because of aid and the money, right? Activists cannot do advocacy and activism clearly if the funder is the person they are funding for. And that is why when I do my mentorship with young people, I do tell them you stand a big danger if you are funded by a government because you will not be able to call them out. We used to find ways of funding our work, and that was not the way it is done currently. Like right now, I'm just saying when you weigh up the options and USA does agree to come back, or this current dispensation agrees to continue funding, I don't think priority would be activists that are going on the street to advocate against them. So I'll stop there. I want us to
I love that, Yvette. I like that, and especially, right. I like it, and especially that you already pointed that after all, where we really need these nonprofits, we have the resources to pay for it as a continent, right? Just one last thing before I ask Angelo to come in. You are on the ground and you've done advocacy, yes. You have perhaps seen community level organizations that are perhaps impacted. Can you paint to us a picture in your space of HIV, service delivery and all that? How great is the impact of the stop work order for USA?
I think globally, it is really a disaster. We have meetings almost every week to take stock of how this has impacted us, but I'll speak on the South African scenario. South Africa pays for more than 70% of our own drugs and our own HIV prevention, right? And that means for healthcare, not only HIV prevention and treatment, but for healthcare. And that means the gap, even though big, the gap for real services, the responsibility of our government, which is healthcare is a right? Is that South Africa doesn't have that big a gap to fill. And it was ready for to fill the gap, and it is working towards that. But that did not come automatic. When we relied heavily on US aid for our treatment did advocates say our government needs to take over the program more than 10 years ago. When HIV prevention, I remember my colleagues went to meet with the Technical Working Group of South Africa, and when they showed us who is the funder of PrEP in South Africa, we told them that is a danger, because should anything happen, it is goodbye medication. But what is happening right now is that some of our health system strengthening, some of our, the human resources in the clinics that's supporting, like I said, the support for government, those are human resources, and that is where we see the biggest challenge, where people had to be laid off. But South Africa also said, how do we integrate that? How do we bring these workers on board to start being under the government's, system? So it's not a good picture. Real life, people were scared. People were not sure where to go, because obviously the healthcare system is heavily based on referrals, etc., for young people to get medication. But we will get there little by little by those who are ensuring that people are referred. So it's a disaster, but I think every African country is supposed to take care of the health of their people.
Thank you, Yvette. And you paint some very important thing. We've always said Africa is not one country. We can see South Africa began the journey of winning off that, and maybe the impact isn't as big at the community level. Angelo, perhaps you've been following what's going on in Uganda. Literally, people don't know where they'll get the next ARVs. In these scenarios where countries haven't been doing a systematic withdrawal from full reliance on aid, and they're saying these are colonial problems, can we still blame our colonial, history to the scenario where we are in? And take us in with your decolonization lens.
Yeah, thank you so much for that question and for having us, and thank you, Yvette, for your thoughts. I think it's important for us to start by acknowledging that what the United States government just did is yet another manifestation of racism, neocolonialism, and white supremacy. Why do I say this? Like, what does authentic partnership look like? If you wake up in the morning and someone you call a partner has torn apart an agreement that you signed with them that ensures that 90% of people living with HIV in your country receive ART or receive medications to ensure that they don't get HIV, would you call that person an authentic partner? One who has your genuine interests at heart? If your partner opens up and closes the switch at their will, regardless of the amount of money that that partner has, in disregard of the implications of those actions, would you genuinely call that person your partner? If you are a business person, would you accept that as an authentic business relationship? I would think many of you would say no. So if you wouldn't accept that as a good business relationship, why would we accept that as a good, acceptable diplomatic relationship? I don't think a partner who respects you would do that to you. As we speak this minute, since this conversation started, people are literally dying every minute because of the actions that a very important partner did. I for one, think that, yes, this is a remanifestation of the colonial tendencies that we know, and we must work every moment to decolonize this. Authentic partnership for me involves mutual respect, accountability, shared decision-making, transparency, humanity, and decency. A genuine partner honors each of the other's partner's needs. And in this case, I don't think that's what we saw. What we saw was a bully who doesn't respect the other partner, even if they think that what they're doing benefits them. And I agree, I do agree that we must take care of our own business. But this is a partnership, and you don't just wake up one morning and just, stop the tap. We have seen the numbers. Samuel started by showing us some of the impact you're seeing in your surveys. Other surveys have been done. As we speak again, thousands of babies are going to get HIV during this 90-day freeze. That's avoidable. We have to remember where, and I'm speaking specifically about the US, aid freeze. This applies to other, future ones that might happen. The justification, or at least part of the justification for the US actions, was they care for babies. They don't want money to be spent, conducting abortions. They don't want money to be spent on, whatever their justifications. One result of this action, the aid freeze today, is that thousands of babies are going to contract HIV. I mean, let that sink in. How do you reconcile that? How are we going to gain back the trust that we have worked so hard over decades to build in communities, to trust the services being given, to trust the researchers, to trust the scientists who are working so hard to ensure that this, our communities remain healthy, remain empowered, remain healthy. I think we need to have these conversations. In fact, UNAIDS, if you go to the UNAIDS website, they have a clock. And as of today, they're saying over 65,000 new infections among adults have happened since January 20th. 65,000. So my point here is this. It is time for Africa to seriously rethink our relationship with America and our relationship with our global North donors in general. The truth is that while much of that aid, that comes to our countries, means life and death in some situations, in most situations, we are not the only ones who benefit from it. And I was actually struck recently when UNAIDS Executive Director Winnie Byanyima said something. She said, "We have the diseases, the West gets the profits." And trust me, I'm not trying to incite a global, the global North against the global South, but I implore you, each one of you, to reflect on this. I think we sell ourselves short in our negotiations, and that's what has led us to this very desperate place. No one has suggested that countries should continue to receive aid in perpetuity. In fact, as Yvette said, we must have these conversations about sustainability. South Africa, as my colleague said, has gone the farthest in funding its own HIV program, with about 17% of their HIV program funded, only 17% coming from PEPFAR. This was an intentional, well-planned effort. It didn't happen overnight. We can't be serious about getting to the end of AIDS when we make decisions like this. And the last thing I'll say is, the US has invested over $100 billion in the HIV fight through PEPFAR. It's more than $6.5 billion a year. Why would a genuine good business person just throw that in the trash and walk away from it? Or at least do what's been done over these past, several weeks, and the damage, some of it permanent, some of the gains that we have lost are not going to be gained back. So my point here is, we must decolonize this. We must, as individual countries, fight to get to be able to take care of our own people. But if we must also reflect on the authenticity of the partnerships that we establish and maintain going forward. Thank you.
I like that, Angelo, because there is no reason to sign up to an SDG goals global level and have all these annual reviews and don't care about what you sign up to. But just one question before I ask Dr. Kiragu, and I'll be looking out for any questions. People can raise up their hands and ask before we go to another set of questions. But back to you, Angelo. Looking at, knowing the history that we've had with our colonizers, the fact that a lot of this aid does not come in from a respectful point, and sometimes exploitative, really. But how do you assess the response that you've seen from our governments in response, especially to the USAID stop work order and the freeze of this? What does that tell you about where we are in decolonizing aid, the journey?
So I think the response hasn't been what I would have expected. There's been a denial that this is happening. Some governments have decided to not even talk about it. We have seen, some governments kind of give responses. So the short and long of this is the response doesn't align up with the dire need for action now. I haven't seen governments, go break their banks to say, listen, again, South Africa has been the exception. They said, we will take care of our people. I want to see what I have seen in South Africa, in Uganda. I want to see that in Kenya. I want to see that in Malawi. And I know that each of these countries has different resource needs, but I also know that many of our governments have their priorities upside down. We have a war going on right now in Congo. That's where look, I've seen, millions of dollars are being spent actually right now as we speak in a war in a needless war. I think we need to reprioritize. We need to, as advocates, push our government to reprioritize. I always argue that we are not poor countries. We just make poor decision-making and prioritization. And if we were only to reprioritize, we should be able to, and later on, I hope we will get to talk about, and Michael, I'm sure he's going to touch on this, some of the ways that we can think to raise resources from Africa that can take care of African problems. Thank you.
Thank you so much, Angelo. And Angelo, at some point in this conversation, I hope you can let us know if there are any examples from the Asia and the East that we can learn from on how you can do this. And this takes me to Dr. Kiragu. Mike, yes, there are different roles that we expect of these, NGOs, the advocacy groups, and all these. But is there a viable funding model that can really ensure that we need these organizations? We need vets of this Africa being able to advocate. Her bills have to be paid. There are costs to run around. Are there models that we can be able to use to make this work out?
Thank you, Samuel, and hi to everyone. This is a really important conversation. It's exciting to come to this place, and not to belittle that some people have been put at risk because of some decisions that have brought us here. But it's a really important time for us. There are opportunities for us now to reflect and go back to where these challenges came from. Part of why we have this crisis right now is the same African governments could not be trusted to support the millions of people who had HIV at the time in the 90s and early 2000s. The aid flows could not trust our governments to channel. They didn't have the systems. They didn't have the execution ability to get the treatment and the support that was needed. But that was not meant to be the state forever. The idea was that role would be transitioned to back to government over time. So we've just fallen off the cliff, but this was something that was bound to happen. Civil society and NGOs have been playing the role of government and neglecting what it is that is for us to do. And in that sense, as we go back to what it is that we are called to do as a nonprofit organization, which is, in my belief, is advocacy is our biggest role. We have talking for the marginalized groups and providing services to some key marginalized groups, but in the aim of bringing back equity. The idea is to bring equity. NGOs, the role of NGOs is to bring equity, because in all social issues, there is some inequity. And so we have to bring that back. So the role of NGOs, and in that, now considering what we are calling the return of non-NGOs back to their work, which is advocacy, generating evidence, generating models for bringing back equity. There are so many models that we can use to fund that space. We are not going to fund, we are not talking about funding for large-scale service delivery, but for our work that is naturally ours as non-governmental organizations. There are opportunities. Let me give you a big example. Now, the US in 2023, when you look at the global tracker for philanthropy, the US overseas development assistance in that year was about 33 billion, spreading out to the whole world. Remittances from Africans back home, only to Africa, was close to 100 billion US dollars. Now that's an opportunity right there. Granted, there are challenges with some of that, but that's an opportunity if we retweaked it a little. It's an opportunity for nonprofits to fundraise from Africans and from ourselves. There are many models, there are many organizations that are on the road to sustainability that are implementing social enterprises pretty successfully. That's a really important space in especially grassroots organizations that are close to the people. You have services, you have products that you can get at a subsidized fee. You can raise money through that and continue your work successfully. So there are many models. There are tweaks that we have to do. Traditionally, again, Kenya, Uganda, Nigeria, even South Africa have been on the list of the most generous people in the world. That is has been there. The Global Giving Index has ranked many of these countries among the top 50, top 100 over the last 10 or so years. I think Kenya has been on number 2 of that list for I think the last 5 years running. That's an opportunity. But there is just some tricks we have to do. People have been giving to problems. You know, people give to their neighbors who are in problems. Now we have to give to solutions. Nonprofits have to talk about the solutions that they're providing. What's the solution to this? And people will, you know, it will take some mindset shifts, including those remittances back home have been to problems, you know, to pay school fees for so-and-so, or to pay medical care for their relatives. That has been there, yes. But we can tweak that and bring back the idea that, yes, as you send back money home, you can send money back to these advocates who are championing, you know, better healthcare within your community and are engaging with your local county or whatever government. So there are opportunities there. We also need to get creative. In this space, we've sort of, we've had it rather easy over time. There is need to be a little bit creative in how we resource mobilize. Another example is volunteerism. Volunteerism is something that has not been tapped into adequately. And I'm not talking about the exploitative volunteerism that we are asking, you know, people who are jobless to come and volunteer. It's asking an accountant who works for a bank to spend, you know, their Saturday for helping with your books. Instead of giving you money, they can give you their time. And that would apply to many things that we need as a sector. You can get people to volunteer their time, volunteer their services. Yeah, advocacy. I mean, you probably need a legal person. why not ask the lawyer within your community to give you guidance, and instead of asking him for money, he can give you 2 or 3 hours of his time. So we need to get creative. The policy and legal aspects of fundraising for nonprofits, I think we are still way out, but we are getting there. Kenya is, we've had a lull on the PBO Act for how many years is this? From 2013. It's a law that allows nonprofits to do business. It allows nonprofits to fundraise from their communities and get some tax exemptions to businesses who can, when businesses donate to nonprofits. Now that's an opportunity right there. We have, we can use it. It has its own challenges. I know the people who have read the law know that there are some challenges that need to be sorted out to improve its implementability, but it's a step in the right directions. And I do believe other countries, African countries can take it up. We can advocate for such an approach even through our AU, and so there are opportunities. We just now have to reorient ourselves, not to be dependent on the West, not to be dependent on aid for our work.
Right. Thank you, Mike. And I think you bring out issues that for sure will require its own seminar, actually beyond just a webinar, to look at models and thrash each of them, in details. Now, I see Angelo's hand up, and I will give you a chance. But as you do that, Yvette, there's a question from those who registered. I want to pick one of those that I think I find very simple. So someone is asking, I am in a community where I'm having a challenge in access to services, like maybe access to psychosocial support for persons living with HIV, and I want to do something about it. When do I start after registration when I have nothing? What happens to community-based South African organizations that have been able to do this? Where do I start? And Angela, you can come in, then Yvette can try and answer that.
Great. Yeah, it's just really to piggyback on Michael's suggestions. I think we know there are models that have been proven to work, and I'm going to share some in the link. There's a campus program, Campus Africa, where we have South-to-South collaborations that are helping to build capacity, share resources, things that are centering communities, things that community priorities coming from the very communities being served, and resources coming from the very communities being served. So Campus Africa is one of them. There is the Aravind eye care system in India. It was founded in the 70s with 11 beds, and now has become a model center with hundreds of thousands, actually millions of eye surgeries that have been done. It came from the ground up, and it's now something that is being replicated beyond India. I have been, I had the pleasure to work on a fellows program that this is a model that funding is coming from the West, but the priorities are centered on what's needed in Kenya, in South Africa, in Uganda, and in different places to build that capacity, to ensure that, again, this can be sustained beyond where donor funds are, coming in. So there are models that have been proven to work, and there are models that are centering communities, so we can build on those. And I'm going to share some of these in the chat. And then the last thing is tapping into, in 2022 and actually last year, remittances from the diaspora, Africans who live outside of Africa, were $100 billion, more than $100 billion. Again, let's think about this. PEPFAR alone has been providing it's about $6.5 billion a year. Remittances from the diaspora were $100 billion in 2022 and in 2024. Think about that as an opportunity for raising funds, to serve the continent. Thank you.
Thank you. Yvette, I've typed there the question. So what this person has asked, if I read it just the way it is, I'm in a community, I want to respond to a gap in service delivery. Where do I start from? And so basically, how do I get going without the money? And any experience from South Africa?
Yeah, that's a difficult one because every initiative does need resources. And I think Michael has mentioned resources is not only money, but it can also be human resources. It can be time. It can be volunteerism. So when you want to start, you need to focus on why are you doing it? You would really need the resources if it is something that is based on money. So I'll make examples. For instance, in South Africa, everybody knows who the activists are, who it can help you at any time. And that does not need money. If you need referrals, if you need to go, somebody to help you, if you need to toy what you call protest, if you need, we know what the Gen Zs did in Kenya. We are there. Some people even call these kind of activists as paid protesters. I think we should have gotten the message when we were called paid protesters in the very first time this current president of the US was the president. He called us paid protesters. He doesn't believe that people can do this out of the humanity, the Ubuntu of believing that somebody else mustn't suffer. So every organization, and I say this, every organization, every initiative, you have to first prove that you can do it with nothing. It's not only biblical, it's cultural, that you can do it. It's inside you to stand up at 12 midnight, go and help somebody who cannot get their treatment, or spare your morning and go and fight for somebody who is maybe not even from South Africa, who need to access their treatment. So we need to go back to that volunteerism. But I don't want to miss a point here, because Michael spoke a lot of how we can do certain things to fill the gap and to reimagine how we see ourselves. We should not forget that Africa has billionaires, has millionaires. A lot of rich Africans are rather funding, and I don't want to sound, not okay, but we are rather funding pageants and all kinds of stuff, whereas their focus should be healthcare. Why are we not reaching them? Why don't they find it sexy to do this? They rather use giving out rice because they want more power in the community. They do all kinds of philanthropy, but their focus is never really helped. Humanitarian organizations, they don't come here in our countries just for fun. They come with some agendas that are deep in our communities. You find a lonely white woman in the back bushes of South Africa, in the village in Zanin. She's not there to just have fun. She's busy with mindset change, telling people this is evil to be lesbian, it's evil to be gay, you shouldn't do this, and got that and got this. All of these things come at a price. And that is why I say Africa should be for Africa. We should be our own solution because of what of the damages they do. I will tell you a story. I was at this camp the other day, and I went there and I could see these people in front of me are foreign, but yes, they greeted me and I said, hello. And I think they thought they didn't know who I was. And they was like, how do you think Trump is fixing things? He's fixing everything. And I'm saying this because I want us to understand the deep hate that some people have. And this lady continued to speak to me, not knowing who I am. She said, a man must be a man, a woman be a woman, a dog be a dog, a cat be a cat. And I was like, ma'am, in this country, what you are saying is very illegal. And she couldn't believe it. She's like, oh. It's like, in this country, we don't discriminate against people. I can actually call the cops for what you just said. And she's like, oh, sorry. But those are the influences. She didn't know who I was. I was in the queue. And if it was not me, she could have influenced a young person, a young Black African child or something, to make them hate their sister, their brother, their friends, the people in their school. So we need to not take for granted these humanitarian things. They are busy with big things that we are not ready to change. We need to change those things that happen and that are very evil to our communities.
Right. Wow. I see we have just 2 minutes left of our time. I want to, if someone has really a burning question, please type it in the chat there. But I'll give one quick round, your conclusion. But for me, what I take home in this is we can go the way South Africa has gone 10 years back, begin winning yourself of aid and begin integrating your funding for intimate things. I call them intimate, health, education, food, security. You really can't leave that to any other person. You must take care of that as a government. I'm also much more optimistic from this call that there are models that have been there, have been shown to work, and we can rally the private sector that we already give us. We just need to not give to problems, but give to solutions. Can you imagine if we gave 2 ideas on creating the next AI solution that will solve something? We will be creating more employment in that way. So I'm very encouraged by that. Though I wonder, these things don't look very strange. I'm wondering, why is it taking so long for them to take off, especially the private sector and the rich people in Africa, and even the ones who are not so rich but are always giving? Angela, then Michael, any last few words on this? And then back to Yvette, then we'll close it at that. And I'm looking for any question out there.
Great. Thank you so much, Samuel. I think my last words are, it is possible for us to do the 2 things, to hold our partners accountable and also to hold our governments accountable. It is possible for us to, to do those things. It is also possible for us to find, efficiencies within our current operations as nonprofits. Do we need 100 nonprofits operating in Kailisha? Do we need to have all these fancy offices that, many of our organizations have? Do we need to have, 500 staff? I think there are efficiencies that can help us to be able to find ways to, without additional financial resources, can help us to, go an extra mile, an extra 2 miles. So I hope that, there will be an opportunity for us to dig deeper into the models and some of the opportunities we already have. And I really hope that we will take this opportunity, take the silver linings that they are in a very difficult time. So thank you so much for joining and for the opportunity to have this conversation. Back to you, Simon.
Thank you. Mike? Thank you.
Thank you.
Mike, over to you.
Interesting conversation. Time is short. My parting shot would be let's get creative. Let's get creative. Let me give you an example, a quick example of how you could get creative. In the fundraising circles, there's a story that's told of an example of how you can get creative in your fundraising. The New York Zoo, a couple of years ago, raised millions of dollars by asking people to come and name one of the animals after their ex. Use your ex-husband, ex-girlfriend, and the animal that you hate the least. You can donate some money and give it a name. And it became a really successful campaign. I mean, that's how creative we need to be. Civil society let me just say, we've gotten lazy. We are not thinking. We need to dig deep, but the resources are there. The people are there. They're willing to give. We just have to give them a reason to give, but not give to problems. Let's fundraise for solutions. Thank you.
Thank you, Mike. Thank you. Parting shot, Yvette, just a few seconds. Yeah.
Yes, I want us to remember that what Donald Trump did is utterly disgraceful. It is not a good thing. However, my big thing and excitement is seeing how some African countries are changing away from depending on aid and are preparing their communities. And even this discussion would not have happened if we were not uncomfortable, if it was nice and we are still getting the funding. But now we are hearing and listening to voices and seeing how this has affected us and how Africans are really asking, are we really poor? Because you take our money. This is not aid. You better bring it back.
Right.
It's our money.
Exactly. And I want to sign off with the comment from Decolonizing from Ethiopia. He's saying he hopes to see a United States of Africa, and I want to add aid fund. You know, we can create our own USAID and do it our own way without strings attached, because yes, the Ubuntu spirit is there. There's always someone who will be in need, but first of all, use our taxes properly and mobilize, organize our communities. We'll come back and explore some of these models, maybe in more detail, use more examples from a few countries in a series of webinars that we can work on. And beyond webinars, let's find the spaces where decisions are being made and influence them for the benefit on the beauty of our continent. Thank you everyone who joined. Thank you our panelists. I really appreciate great insights. You are our best in the continent. Please don't keep that knowledge. Let us not shy out in being able to call to action those who are responsible. Everyone have a great day, a great evening for the rest of you. Thank you very much. Bye-bye.